Hello, so this is my vlog for week 12. I'm going to be answering questions 1 and 3. So, question 1, according to the reading Sandcastle and Snake Pits, which two historic public policy initiatives created worse outcomes for people with mental illness, and explain how these two initiatives affected mentally ill people? So, the two historic public policies that were created were the Housing Act of 1949 and the Community Mental Health Centers Act. So the Housing Act of 1949 was passed to ensure urban renewal and a proper living environment for everyone. So, however, many poor people who lived in urban environments, their houses were destroyed and torn down, and many of these people became homeless because they couldn't afford either new housing or go elsewhere. So or many of them were left in the streets. And a lot of these individuals were mentally ill. So this act only positively impacted the rich and therefore left many mentally ill and poor people on the streets without help. And the Community Mental Health Centers Act was created to provide community-based care for those with mental illness and remove them from mental asylums. However, this act only left patients without proper care because this act was poorly funded, and these hospitals were poorly funded. So many of these people who were meant to be in these research facilities were left with their families to be cared for, or left in these research centers where they had poor care because they were poorly funded. And as a result, they were either put in with their family or just went homeless because they couldn't afford the care. And for number 3, based on a slow toxic decline, what was the fate of many dialysis patients in the Katrina hurricane disaster? And how does their fate epitomize the intersecting problem of health and race in America? So a lot of dialysis patients were not able to receive proper care for their illnesses after Hurricane Katrina because of the devastation of the storm. This was due to a lot of things, such as damages to transportation, lack of proper resources, and because specifically in the dialysis case, there was poor water supplies, which was needed for doing dialysis. So because of all of this, the fate of many people who did not get dialysis care were in life-threatening danger because they couldn't get the treatment they needed, and a lot of them were either in life-threatening danger or could die. So, and not to mention, many of these people were homeless due to the devastation of Hurricane Katrina. The fate of this epitomizes the intersecting outcomes of health and race in America, because individuals who did get the health care for dialysis were mainly rich people, and these were generally white people in society, and the poor people were left with little to no health care, and these were generally minorities and people of color. So this intersects with the healthcare crisis and the race crisis, because these two issues are directly correlated in the case of Hurricane Katrina, because the people who didn't get the care they needed were also Black people and other people of color. So 2 questions I have for you. Question 1 is, what are some ways we can ensure a more equal healthcare system and opportunity for people that allows minority better care? And question number 2, what are some ways we can improve upon the healthcare weaknesses in cases like Hurricane Katrina? So in other words, how can we ensure better healthcare for those in need in a time like a natural disaster?